Hi everybody, my name is Peter Wood and I'm the Chief Operating Officer of Mmhg. And our goal is to ensure patients have the technology to partner with their providers to maximize both clinical outcomes and business revenue. Considering just hypertension, which is the #1 risk factor for death and disability in the world and a major focus of ours, well, the addressable market is vast and the need for an effective solution is clear. Over 100 million people in the US have hypertension and 1.5 billion people globally. And the control throughout these populations is very poor. And it just doesn't have to be this way. Fortunately, a clear solution has emerged and is based upon foundational work by organizations such as Kaiser Permanente, the World Health Organization, American Medical Association, and the American Heart Association. And that solution is to implement simple, efficient self-monitoring systems coupled with team-based protocolized care. So to emphasize, the need for a simple but elegant method of blood pressure self-monitoring is obvious. As such, we've designed a cloud-based solution, which is shown here. The platform consists of easy-to-use, intuitive, patient-facing smartphone applications, and therefore scalability is not limited, and a web-based portal which supports seamless integration into clinical workflow. You can see the patients can enter their data using Bluetooth device transmission or manual entry, and this is shown on the left here, and guidance is provided on how to follow best practice within the application itself. In the middle, you see our smartphone application that stores and securely relays data to the cloud, available globally in 2 platforms, iOS and Android, and in 4 languages. Clinicians are able to visualize the remotely transmitted data via the clinical portal, and the focus is on giving them tools to deliver care efficiently and in a guideline concordant manner. As an academic-based company, we developed this Figmo platform to enhance data collection, accuracy, and support best practice in delivery. Our platform is device agnostic and it pairs with over 30 Bluetooth devices. Patients are instructed how to perform their measurements accurately following professionally recommended technique, and our patent-pending swipe averaging tool allows for near instantaneous summarization of data in a manner that is consistent with the American best practice guidelines. Our customers leverage a range of established remote patient monitoring codes, chronic care management bundled payment options, and government grants to drive their revenue. We offer subscription-based licensing models at extremely competitive prices that can also be bundled with hardware solutions. We can set your clinic up in 1 to 2 days, train your support staff, and help you realize remote patient monitoring revenues within 8 weeks. You can see here is an example of revenue that can be generated through the use of currently existing Medicare and Medicaid physician billing codes. As you can see, just with 100 patients per year, the revenue opportunities are quite large. Our team has been swamped with several high-profile partnership commitments of late. Unfortunately, many of them we cannot currently reveal publicly. However, we have established 7 major partnerships in the 7 months, contracted over $500,000 in revenue, and have grown our app user base to 25,000 simply through organic growth. And we have recently finalized a strategic partnership with A&D Medical, a global blood pressure device manufacturer with offices in Japan and the US. Our original product was designed to deliver a guideline concordant blood pressure telemonitoring experience to patients and their providers. Since our original product, we have expanded the Vitals offerings. And our next phase of development is to integrate a novel cloud-based ambulatory blood pressure monitoring platform, which is the gold standard test for hypertension diagnosis, into our current platform and then expand into advanced analytic engines. We've assembled a world-renowned team of experts. Our CEO, Dr. Raj Padwell, is the previous chair of the Canadian Hypertension Guidelines. He also sits on the International Standards Organization Committee for Blood Pressure Measurement and is a full professor of medicine as well as an internal medicine physician. Myself, I have over 10 years experience in cardiac diagnostic devices and academic research in technology-assisted care and blood pressure measurement. Jennifer Ringrose, our Chief Medical Officer, is an Associate Professor of Medicine, a physician specialist in general internal medicine and blood pressure management. And Steve Plunkett, CEO of A&D Medical Americas has recently joined our board of directors. Thank you for taking the time to listen to my presentation. If you have any questions or are interested in adopting one of our products, please do not hesitate to contact me at the following address. Thank you very much for your time.